Hello, folks. This is Dr. Mark, actually, Dr. Mark Carriage. Call me Dr. Mark. I've been called a number of things working in the prison system. Uh, or Dr. C. I've been around for a long time. I'm working on a video series with using hypnotic intervention. I got like 6 videos and one on the unconscious process. Um, so today is part 3 of that series. A little bit about myself, and I want to emphasize that this is a professional educational video. All my videos are educational in nature. I will indicate if it's general audience. This is for a professional audience. No kids, just professionals. A little bit about myself. I've been around for 45 years. I got a bachelor's degree in 1979 at SIU Edwardsville, master's in counseling at St. Louis U, followed by a PhD in counseling in 1985. And at the same time, I completed a counseling psychology internship at Texas Tech University, Lubbock, Texas, which I really got a lot out of. It was very good, very good. I currently in private practice working for Chad Welch at Metro East Counseling in Swansea, Illinois. We have a whole slew of therapists, so feel free to give us referrals. I thought I'd throw a little pitch in there for Chad and company. I want to say that I had the honor to travel with my father, Dr. Peter Carriage, in the 80s as he was on the faculty of the American Society of Clinical Hypnosis workshop conference um, in from the mid 70s and throughout the 80s. So he went around traveling, teaching hypnosis and hypnotherapy and stuff like that. I was able to tag along, and that's when I met the best in the world in that era, except for the great Dr. Milton Erickson, who passed away in 1980. I never did meet him, but I certainly had training and met with the people that worked with him and or studied under him and or were colleagues. And so my goal is really to do this video series is to give back professionally, pay it forward, if you will. Matthew Adams is not here at this moment, but he is the one that's instrumental in helping me do these YouTube videos. I could be reached at mcarriage, which is MCARICH at AOL.com. If anybody wants to get a hold of me, don't try calling me because I'm not going to answer the phone. And yes, AOL.com. It's still functioning. It's not dial up. That's the truth. But it's not dial up. And I do have a flip phone too. Okay, so we're on part 3 of this whole thing. And I want to say the paradox of the hypnotic stuff is the irony is that you consciously focus on something and then tap into or access the unconscious process. So, what are we talking about? Hypnotic experience. If you haven't watched the other videos, let me briefly kind of go over it. And this is a 15-minute, no more than 20-minute video experience. Hypnotic experience, I like to call it experience because there's a controversy versus state versus non-state on the hypnotic phenomena. So I call it hypnotic experience to include both. Uh, you can really tell I'm a modern and stuff. I think things through. I try to integrate as much as I can when it can be. So this is my way of integrating both polarized theoretical camps, if you will. And I do like to use the word state. I like to throw it around. But experience works just as well, and it involves an internal focus of attention on some selected stimulus. You're focused on something, or the client is focused on something, thus creating a dissociative, which means detached response at one level. And then again, you're oblivious to immediate surroundings. Okay, focused attention, that is really the central theme, or should I say, refocused attention and heightened concentration. So more on the definition. I'm going to repeat some of this. Sometimes this kind of work needs repeated to fully get it. The hypnotic experience is you're consciously focusing and refocusing, fixated is the good word, on some selected internal, external stimulus, usually interrupting the previous or current flow of stream of consciousness, if you will. It's suspending it because you're accessing the unconscious. You're actually creating a cascading effect to the mind body process. Many years ago, when I was young, we used to argue about the mind versus the body and come to the conclusion that they are interactive. You can't have one without the other. As Bradford Kinney used to say, they'd form a cybernetic complementarity. Because without one, you don't have the other. Anyway, there's a cascading effect where immediate consciousness is and behavior is temporarily suspended, ultimately creating a dazed experience. There are many forms and expressions and levels of the hypnotic experience. I went through all that in the first couple of video snippets, parts 1 and 2. I think I even went in the introductory one for the general audience as well. But some basic forms includes mindfulness. Everybody likes to toss around the word mindfulness, but it's hypnotic. It's very hypnotic. Relaxation is hypnotic. Deep breathing is hypnotic. Imagery is very hypnotic. In fact, when we do hypnotherapy, a lot of the times, if not all the times, we're using a lot of imagery. Imagery is simply envisioning. We used to call it visualizing, internally visualizing, but I call it envisioning because you're using maybe a variety of the five senses. Um, so you're envisioning something mentally. Okay, so back to this end of this PowerPoint, creating a dazed experience or sense of detachment. And it's an altered experience, suspending current overt, covert behavior because you're refocusing on something. It's like you turn the TV on, you really get interested in whatever, and you're so focused, you become entranced. It's the same stuff, but we're trying to use this clinically. And today's this video's focus is on inductions. Again, inductions is the key word. Um, so at one level, you're focused attention. At another level, you're still in contact with reality, or else you'd be psychotic, and the two don't go together. So a hypnotic state is usually defined as a suspended state from immediate awareness, a state dependent, if you will, from immediate awareness or that current stream of reality. Because you're in another reality. But yet part of you is still in the external reality and your own internal reality. So it requires some degree of internal absorption. There's a number of hypnotic inductions. In fact, ASH, the American Society of Clinical Hypnosis, which is one of the best ways to get trained in this. And I wouldn't go out doing all this stuff. You can do basic imagery, maybe basic relaxation stuff without being formally trained, but I would get training and I would get training from them or the Ericksonian Foundation, either way. But the ASH put out in 73 a syllabus, and followed by 1988, another syllabus on hypnotic inductions and different techniques and different scripts for the techniques. Followed by Hammond in 1990, his Handbook on Hypnotic Induction, which is really the handbook on this stuff. There's other references and such I have mentioned throughout these video series. To capitalize on the key elements, your focus, you're refocused on a selected stimuli. So focused attention and concentration, heightened concentration, thus creating suspended behavior or immediate awareness of oblivious, or where you're oblivious, not aware of other stuff going around you. Creating a dissociative detached response or state. Ernest Rossi always obviously emphasized the mind body is connected, but he also emphasized state dependent behavior, memory, and learning. So he says things are learned in states. Obviously, and some things are generalized to other states, or we wouldn't function in a society. But he always said there was a cascading effect. Now, when it comes to strategies in terms of inducing or trance inductions, if you will, there's the direct and indirect. I have studied both. With most of the clients, use a more direct approach, which means I'm still old fashioned. Obviously, I'm on AOL and I got a flip phone. What more do you need to know? Um, but I like to write out my scripts. I like to plan out my session. And so I have done the indirect as well, which do some spontaneous stuff. Like one time I was running a group at Menard Psychiatric Center with some high risk guys. And one guy went into a spontaneous trance, recalling his history, offense history. And his arm was stuck out. We call it hand levitation, arm levitation, for 45 minutes while he was in a deep trance for real. Some of the other group members got a little edgy, and I told them to just chill out, just let him do his thing. But that would be then I obviously used some intervention and redirected his experience. But that's an example of an indirect. Um, or perhaps you're having a conversation with somebody and you drop some messages in there and metaphors, and that could be trance-like as well. Okay, but the direct trance, what I do, I like to prepare the client for the experience, educate them, go over the do's and don'ts and the myths and not myths and all that. Take the mystical, magical stuff out because it is not mystical or magical, and ensure that they're still in full control of their own experience. Bottom line on that. The formal trance induction will start with refocusing the client's attention, selected stimulus. You want to captivate their attention. You want to funnel, um, really cone in on or hone in on their what they're focusing on, reinforcing that concentration. They become internally absorbed in the content and the process. Can't separate the two. Create behavioral and immediate awareness in a suspended state, thus creating a dissociative state. And you want to monitor immediate outcome. Always, when you're doing interventions, you always want to see how the intervention works. What do we call that? Basic practice research. Because if the intervention doesn't work, then you want to do something different. Then monitor more of the outcome. Do a trans exit formally, and then monitor that outcome. So indirect, what are we talking about? We're indirectly, without a script, without a standard, we're just inducing um, hypnotic experience. A lot of times, because we all go in and out of hypnotic states all the time, Milton Erickson used to hold 2 hour sessions, which is a bit much for me, I must say. But he did because he knew the client would go in spontaneously every 90 minutes, go into a trance state or experience, and he would then captivate the client's attention and refocus on the problem resolution. So, whether you use natural states or just captivating the client's attention onto something, following that reinforcement um, of that focused concentration, ensure they're internally absorbed in that content, then work the process. Their immediate awareness is suspended, thus creating a dissociative state. Monitor the immediate outcome. Exit the trance experience if necessary, might not be, and monitor the outcome. Inductions. So the key is really refocusing the client's attention verbally and or non-verbally. We'll talk about the pantomime trance inductions towards the end of this video. which is coming up. Uh, so the point is you're creating a sense of detachment, or I like to call it dissociative state. Um, and an overall generic procedure, I like generic procedures of stuff, get down to the kernels and look at the stuff, and then see what is, when you melt it all down, what's left. And here it is, the generic strategy. You connect with the client. You want that rapport. You got to have that rapport with the client if you're going to do real therapy. Um, Unless you're deliberately trying to do something for an intervention, but you better know what you're doing. So let's assume you connect with the client because this is what this is based on. Refocus and fixate the client's attention. Uh, you want to further that concentration by developing rhythmic patterns. You want to slow down your responses, then slow down their responses. Typically, if you're doing a standard procedure, they're not going to be talking. So you slow down your responses. If you're doing the indirect, you want to slow down their responses. Low monotone voice. You want to induce a lot of imagery, reflection, if you will, on that imagery. Use pauses, some deep breathing, pacing and leading, behavioral suspension, creating a dissociative response. Obviously, you want to pick up on the behavioral suspension and furthering that dissociative response. And some popular phrases that Corey Hammond, 1990, outlined. He actually listed, and I took them from him, but I'm giving him credit for it, obviously. Um, some phrases include you can wonder, you can notice, can you notice? You're not telling the client what to do. You're eliciting their cooperative responses, if you will. You're letting them make decisions. Perhaps noticing, again, by saying that, you're pointing to a direction, but you're not telling the client to do it. You're implying that. Implication is really involved in this, but we don't have time to go over that. That would be another hour lecture. I like to begin. I like you to begin allowing yourself to whatever. And if you wish, is another phrase, couple phrases, and you can wonder what, and in an interesting way, you'll discover um, that's just fine. I wonder if you'll be reminded by just noticing whatever, that's okay. Uh, I wonder if you'll be interested in learning how to, whatever the points you're trying to make. Um, some When you're doing the verbal responses, make sure you keep it simple unless you're deliberately trying to confuse the client, which is an induction technique, or deliberately vague where you're trying to get the client to fill in the gaps and then induce a trance that way. But other than that, you want to try to keep it as simple as possible. Um, so we're talking about the hypnotic language, um, and another couple of phrases to wind this up. And you could begin to wonder when, with your permission, now I'd like you to have a new experience in a way that meets your needs, and on and on and on. So the key words in the language is wandering, such as imagine, notice, explore, and understanding. The key is to evoke a hypnotic response or state via the language. We'll get into the nonverbals in a minute. So then utilize whatever techniques you need to utilize in order to move the client from A to B. So in a summary fashion, you're focusing attention on selected stimulus. You're interrupting or disrupting their current immediate awareness of attention because you're refocusing their attention from what they were doing to something new. You suspend the experience, creating a dazed response, if you will, a dissociated sense of being detached at some level. So again, fixated attention, suspended experience, dissociated trance experience, and I don't know why I got the fixated attention there again, but whatever. Distraction creates a pause of a state focused concentration. Why are we talking about distraction? Because distraction is central to hypnotic induction because you're taking the person from what they were focused on to something different. You're distracting from the immediate awareness of what's going on. It involves the client's immediate awareness by funneling concentration on some stimulus. And picture a funnel where you start out big and you go down little because you're focusing on that stimulus. You stimulate the right hemisphere functioning while engaging the left hemisphere. Now, it sounds paradoxical, and I always thought the unconscious was mostly in the right hemisphere, but there's points all over the place. It's kind of a messy map, if you will, of the brain. But for our sense, right hemispheric functioning works very well. And Langton and Langton in their book, Unanswered Something or Other, Metaphors, Embedded Metaphors, they really talked about the right hemispheric functioning versus left, and that was a 1983 edition. So, as a therapist, you use a low, monotone, rhythmic, soft voice, um, accenting particular meanings and messages. If you accent it, you're emphasizing it, and that's what's important. Using metaphors that relate to the client and connect with the client. The process should be soothing, often inducing relaxation or a relaxed state for the client. The key to hypnotic inductions involves refocusing the client's heightened attention and concentration, suspending immediate consciousness, immediate awareness of whatever they were doing to something different. Paradoxically, you're accessing the unconscious process. So, before I go to my favorite go tos, usually, everybody has their favorite go tos and techniques and such. I tend to well, I'll give you a couple examples that were not clinical in nature. Back in the 80s, we in DOC used to get audited pretty heavy. The director of that era used to use his audit team as his personal Gestapo. In other words, they were ordered to find flaws, audit findings, etc., and so they can punish the wardens, which that cascaded into a lot of pressure on us trying to make sure we don't have audit findings, which is impossible. At any rate, an auditor was looking through the medical record. I was with him because he was going over the mental health section. And then I saw some glaring audit finding. So I was moving my finger around, confused the crap out of him. And he was confused. I flipped the page. He didn't even notice. Another file, there's another audit finding. Kept getting these darn audit findings. And so he really took particular interest in our director of nursing. And she knew it. But anyway, we're in the middle of this intensive audit. I saw another glaring audit thing, and this time I brought her over to help explain the medical piece of that. And he was so enthralled with her that I flipped the page, and that was the end of that one. Got out of that one. Now you're saying you're manipulating. Yeah, heck yeah, I was manipulating. Of course I was. We manipulate our clients. That's a whole nother discussion on the therapeutic side, which I've designed a series of videos for that. We do manipulate the clients because the clients manipulate us as well. We live in a society, a culture where we manipulate each other. That's how we get by. Hopefully, there's a lot of cooperation and what have you within that. So, with that non clinical setting, I did. There's another time, well, I'll talk about that example in a minute. We talk about the pantomime techniques. So my go-to favorites is some deep breaths. I like to stir up the imagery with metaphors of relaxation and focusing, distraction from the outside stimulus. That's why I always have them close their eyes because it shuts down the outside stimuli. Pretty good. So I use an eye fixation technique, which is classic. The client keeps their head level, and you're at a 90-degree angle, and no, they're at a 90. Their eyes are at a 90-degree angle, and you're enforcing that, and their eyes naturally will get heavy. You suggest your eyes may become heavier and heavier to the point where it's just easier to close them, and they do. Then you go on with some more deep breathing. I like more deep breathing. I will then use deep muscle relaxation. I might use some imagery even before that or after that on what they consider very relaxing images. And I will, if I'm doing some intensive work, I'm going to actually frame up a safe zone for them, a safety zone, a calming zone, if you will, a strength zone as well with images. Then I go into the deep muscle relaxation, which I use the push release I made up, published in the late 80s, because I push out tension. I don't know if you've had the experience of tightening up muscles and then trying to release for the release of it, and I get cramps. I do not like cramps. I'm not into punishing myself, especially in this kind of context. When I was running cross country in high school, I guess I was into punishing myself because that was punishment. But this is not cross country. So, and by the way, that was a joke. I like to, instead of tightening up muscles, just push the tension out and feel the warmth, the relaxation flowing through. Okay, I did provide a basic relaxation protocol. Doing that, I'm not going to go through it tonight. I will be putting it probably on for a general audience. But if you're going to do it, make sure you're at home or at a place where you can sit down, lay down, and relax for at least 20 to 30 minutes. Um, and you can email me, mcarich@aol.com, and I will send you the PowerPoint if you can't pick it up on this video presentation. The script goes like this: take a few deep breaths, and then you get into the muscle relaxation through each muscle group. I like to do like the left arm, then the right arm, the left leg, or the right leg, then the left leg, and all that. Because the more you do it, you're slowing everything down. You're getting the client to relax, and that's the rest of it. Um, Now let's talk about some other basic ones like pantomime techniques, which is a nonverbal. You can do the hand levitation, having the hand feel lighter, lighter, lifting up, 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 and then going into a deeper trance experience. Um, I don't usually do that one. I may suggest that the hand might get lighter in the trance experience and want to float up. If it does, that's fine. Um, the other thing I forgot to mention when you're doing an induction, you want them to exclude hearing noises. So I reframe the noises either in going deeper and deeper or just simply ignore it. Either way, double bind. Um, Ideomotor signaling is finger movements, nonverbal finger movements. Generally, I do not verbally talk to the client why they're in trance experience. I ask them questions and they respond by finger movements, yes or no. So I know what they're experiencing. Ernest Rossi, on the other hand, used his moving hands technique, which he's published books on. And actually, I've seen him demonstrate this technique where a client resolved their issue. He was just directing them on the hands technique, moving towards resolution and such. he didn't even know what the issue was. I kid you not. You can do therapy without doing therapy. The handshake technique, that was Milton Erickson's famous technique. Bandler and Grinder of NLP, they've got videos on how they do it. There's other videos out there on how other people do it. I've studied the technique. Um, in fact, if you have a crisis client, shaking their hand, probably not during COVID, but we're not in COVID. Shaking their hand, and what you do is you slowly, um, you shake their hand normal, then you slow down the rhythm. You move your fingers slightly, which distracts them. Again, distracts their focusing on the handshake, creating a distraction at both conscious and unconscious levels. Then you can follow up with some eye closure or whatever you're trying to do. I did the pantomime technique on the handshake with. I did back in the old days. We used to be able to actually do demonstrations where grad students actually could learn from the professors on how to do stuff because you demonstrated how to do it. Back in those days, did have I was talking about the hypnotic stuff and did a couple of handshake techniques. And one of the students said she didn't believe it was bullshit. And so, oh, I guess I shouldn't use that word, but it was what she said. And I said, well, you won't know unless you try it. And so she stuck out her hand, gave me permission. And I always got permission to do this stuff from the students or the client or whatever. And so I shook her hand, put her hand in the trance, put her entire body in a trance. Her hand was immobilized in the air. And I went on lecturing to demonstrate to the class that this was not a hookup or any other kind of thing. Long story short,